Madam President, I know that we'll be offering amendments through the afternoon, and we look forward to ample debate and discussion on them. I want to reiterate my appreciation to Senator Burr for the way we worked together on this bill. He was very generous in his comments to me and about me, and I appreciate this. But what I so appreciated in working with him is that his whole focus was, how do we really protect these children? And his work to ensure that the children were safe when they were at the daycare, regardless of the size of the provider, was really important. So yes, we have good background checks. At the same time, we were looking at health and safety standards, making sure that the staffs were at least trained in the elements of first aid, so that if they needed help because they had swallowed something until the 911 responders could be there were really important. And yet we had to look at it in a way that we didn't over-regulate. So we wanted quality standards, but we didn't want to have so many rules, so many regs, exactly what Senator Alexander cautioned us about. Let's not over-regulate so that we then stifle or end up shrinking the pool. So we again worked on what the phrase sensible center really comes from Colin Powell, that if we work hard and listen to each other, we find that sensible center. So it was the balance between federal standards, but also local flexibility on the best way to achieve those standards. And also to help states pay the bill for the training. One of the things that we've done in our bill was set aside 3% of funding to expand access to improve the quality of care, especially for infants and toddlers, the most vulnerable of populations, because they can't tell you things. You know, they can't tell you where they hurt or some of these others. In addition, the amount states set aside for quality improvement also must be at least 10% within 5 years of enactment, and states must say what they choose to invest in. We hope not only to have reporting and accountability, but really to get an idea for best practices that we can circulate among providers, and we think that this will be really important. The other area that we focused was Senator Burr talked about providing protections for children who receive assistance. Exactly what I heard in Maryland. You know, this is all income-based. In other words, your voucher, this is a means-tested program. But if your means change in the program, you could lose your daycare. So it was an actual disincentive from improving yourself or maybe taking a seasonal job. So if you had the opportunity perhaps to work in retail during a holiday season, exactly for your own family's holiday celebrations, you were going to be tremendously disadvantaged because it would be a boost. It would look like you've gone up when actually your income might be the same. So if you've taken that part-time job. So we want to reward work. We want to reward personal responsibility. So we were able to provide that flexibility that when parents redetermine their eligibility, they'll give them ample opportunity to be able to do this. So if your child is in daycare and you take that part-time job or your income goes up, you won't lose the daycare you have for that year or that determination. So we thought that was important. The other thing was meeting the needs of children with disability. This was a strong passion of Senator Harkin, a well-known advocate for people with disabilities, and I know he will speak to that. But it will require states to examine what are they doing to coordinate with the IDEA programs, again, for preschool-age children with disabilities. Often a child who faces a disability is at a disadvantage because of the daycare that they're in doesn't promote learning. We have a situation, can I have Ms. Rivera? I have a constituent in Maryland. She spoke at our press conference yesterday. Her name is Kathy Rivera. She's the mother of 2 children, age 7 and 2. She is also a resource person working at Centronia Family Center, which is information and services, and also focuses on early childhood education. Now, her little girl was born without an ear. That's rough going. So imagine being an infant, then a toddler, trying to learn language. Your family is bilingual. It could be a great asset, but when you can't really hear and the doctors are doing the most for you to help you, you still need to be in an environment that acknowledges that and is helping with the learning in childcare, so at your pace, your way, so that your language skills are also developing, because language and brain development are tied together. So without the proper environment, this little girl would have been doubly disadvantaged. One, with the physical situation from birth, but then the learning situation because of where she was. Well, fortunately, because of her mother working in the field of daycare, working at a very agency who provides information and resources, and with the help of the child care subsidy, this little girl could be in the daycare that she needs to not only look out that her physical needs are being met, but that her learning needs are being met. Isn't that a great story? Isn't that a great story? But here's a mother who is working, a bit strapped financially, but with her own sense of motherhood and personal responsibility. She found what she needed. The child care subsidy was able to help her pay for the daycare, and now this little girl has a promising, it's going to be a challenging future for her, but she's ready. She's up for this challenge. This is what this is. This isn't only about numbers and statistics. So when we talk about improving quality, we've really tried to take into consideration of these needs. You know, daycare is expensive. And in Maryland, the Maryland Family Network tells me that they had, with all of the licensed daycare, over 23,000 children were on the wait list for this program. Not for daycare, that's even larger, but for this program. So this is why we want to pass this bill and really be able to move forward on it. But again, I'm going to come back to this bipartisan effort of focusing on safety, security, and also learning readiness. So, Madam President, I yield the floor, and I'll say more later.